Which of the following is the most common cause of acute kidney injury, AKI, during or after cardiopulmonary bypass, CPB? A. Hypovolemia. B. Renal ischemia. C. Hemolysis. D. Sepsis. Answer: B. Renal ischemia. Explanation: the most common cause of AKI during or after CPB is renal ischemia, which can result from reduced renal perfusion during CPB. The kidneys are particularly sensitive to changes in blood flow, and ischemic injury can lead to acute renal failure. Hypovolemia, hemolysis, and sepsis can also contribute but are less common than ischemic injury. Which factor is most associated with an increased risk of AKI in patients undergoing cardiopulmonary bypass? A. Use of low-dose heparin. B. Duration of cardiopulmonary bypass. C. Age less than 60. D. Normal preoperative renal function. Answer: B. Duration of cardiopulmonary bypass. Explanation: the duration of CPB is a key risk factor for the development of AKI. Longer CPB times increase the chances of renal ischemia due to prolonged hypoperfusion, as well as the potential for inflammatory and hemodynamic changes that negatively impact renal function. Preoperative renal function, age, and anticoagulation dose also influence AKI risk but are not as directly related to the duration of CPB. Which of the following interventions is most commonly used to mitigate the risk of AKI during CPB? A. High-dose corticosteroids. B. Renal dose dopamine. C. Use of a pulsatile perfusion pump. D. Aggressive fluid resuscitation. Answer: C. Use of a pulsatile perfusion pump. Explanation: pulsatile perfusion during CPB helps maintain more physiologic blood flow, improving renal perfusion and oxygen delivery to the kidneys. It has been shown to reduce the incidence of AKI compared to non-pulsatile perfusion, though its benefit is still debated in some studies. High-dose corticosteroids, renal dose dopamine, and aggressive fluid resuscitation have not consistently demonstrated protective effects for AKI prevention. Which biomarker is commonly used for the early detection of acute kidney injury, AKI, in patients undergoing cardiopulmonary bypass? A. Blood urea nitrogen, BUN. B. Serum creatinine. C. Urinary output. D. Serum cystatin C. Answer: D. Serum cystatin C. Explanation: serum cystatin C is a newer biomarker for the early detection of AKI. Unlike serum creatinine, which is affected by factors like muscle mass and hydration status, cystatin C more accurately reflects changes in kidney function. It can detect AKI earlier than traditional biomarkers like BUN and serum creatinine. Urinary output is an important clinical measure but is not as sensitive for early AKI detection. Which of the following is a primary preventive measure to reduce the risk of AKI in patients undergoing cardiopulmonary bypass? A. Use of a higher than normal perfusion pressure. B. Limiting the use of diuretics during CPB. C. Ensuring adequate hydration and normal volemia. D. Restricting fluid intake postoperatively. Answer: C. Ensuring adequate hydration and normal volemia. Explanation: maintaining adequate hydration and normal volemia during and after CPB is crucial for ensuring proper renal perfusion. Hypovolemia can exacerbate kidney injury, and good fluid management helps minimize the risk of renal ischemia. Other factors like perfusion pressure and diuretic use may be managed but do not have the same direct impact as hydration and volume status. Which of the following interventions is most effective in treating AKI in a patient after cardiopulmonary bypass? A. Diuretics to increase urine output. B. Renal replacement therapy, RRT. C. Intravenous vasopressors. D. Glucocorticoid administration. Answer: B. Renal replacement therapy, RRT. Explanation: renal replacement therapy, RRT, such as hemodialysis or continuous renal replacement therapy, CRRT, is the most effective intervention for patients with severe AKI that does not resolve with conservative management. Diuretics may help in some cases of mild AKI but are not effective in cases of renal failure. Vasopressors and glucocorticoids may be useful for maintaining blood pressure but do not directly treat AKI. Which of the following is a known independent risk factor for AKI following cardiopulmonary bypass? A. Male gender. B. Pre-existing hypertension. C. Low body mass index, BMI. D. Use of beta blockers. Answer: B. Pre-existing hypertension. Explanation: pre-existing hypertension is a well-established independent risk factor for AKI following CPB. Hypertension can lead to chronic kidney damage, and during CPB, the kidneys may be more vulnerable to ischemic injury. Other factors like gender, BMI, and beta blocker use do not have the same strong correlation with AKI risk following CPB. Which of the following best describes the pathophysiology of AKI during cardiopulmonary bypass? A. Acute glomerulonephritis due to immune reaction. B. Tubular necrosis due to renal ischemia. C. Decreased glomerular filtration rate due to hypotension. D. Obstruction of renal blood vessels by microemboli. Answer: B. Tubular necrosis due to renal ischemia. Explanation: tubular necrosis is the primary pathophysiological mechanism of AKI following CPB. Reduced renal perfusion during CPB can cause ischemic injury to the renal tubular cells, leading to cell death and dysfunction. This results in impaired filtration, electrolyte imbalances, and fluid retention. Hypotension, glomerulonephritis, and microemboli may contribute but are not the primary cause. Which of the following is the primary mechanism by which cardiopulmonary bypass, CPB, contributes to acute kidney injury, AKI? A. Direct nephrotoxic effects of heparin. B. Hemodynamic instability leading to renal hypoperfusion. C. Increased systemic vascular resistance. D. Release of pro-inflammatory cytokines leading to glomerulonephritis. Answer: B. Hemodynamic instability leading to renal hypoperfusion. Explanation: the primary mechanism for AKI during CPB is hemodynamic instability, which leads to renal hypoperfusion. The kidneys are highly sensitive to changes in blood flow, and during CPB, the renal blood flow may decrease, causing ischemia and injury. While heparin and inflammation can play a role, renal hypoperfusion is the most significant factor. Which of the following is a common consequence of AKI in patients following cardiopulmonary bypass? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Hypoglycemia. Answer: A. Hyperkalemia. Explanation: hyperkalemia is a common complication of AKI due to the kidney's inability to excrete potassium efficiently. This is especially dangerous as it can lead to life-threatening arrhythmias. Patients with AKI often develop electrolyte imbalances, including hyperkalemia, as renal function declines.